Talofa, everyone. My name is Andy Subika, and I'm a clinical psychologist and assistant professor at the UC Riverside School of Medicine. For many years, I've worked with Pacific Islanders around mental health and substance use issues. So today, I'm going to give you a three-part video just talking about what is mental health. The second is what does mental health look like for Pacific Islanders during COVID-19. And the third video will talk about what can we do when we're experiencing mental health difficulties during COVID-19, but also just in general. So let me just tell you a little bit about what mental health and what we refer to as mental illness is. Mental illness is a common medical condition similar to asthma, diabetes, heart disease, cancer. Mental health issues or mental illness is a medical disease. Mental illness disrupts a person's thoughts, feelings, emotions, behaviors, also their ability to interact with each other or to get their work done. It is not caused by weakness, by a person being lazy, or doing bad behaviors. Mental illness is not caused by bad parenting or by a family's bad blood. Again, it is caused by a chemical imbalance in the brain. So one way to think about this is if you think about somebody who has diabetes, what has going on in their body is that their blood sugar levels are not settled. They're out of balance. And because of that, they experience a number of physical problems. Well, mental health issues are very similar. The chemicals in the brain are a little bit imbalanced. And so one thing that we do in treatment is just provide medication that's similar to insulin for diabetes to restore their blood sugar levels to a normal level. The medication that we provide someone who's having a mental health issue just restores their brain chemistry back to its original condition. So in sum, mental illness is not a person's fault. It is not the family member's fault or anyone in the family, and it can be treated. So what are the most pressing mental health issues that are facing Pacific Islanders? There are three I want to talk about today. The first you may have heard of is called major depression, or just known as depression. And this involves extended feelings of sadness that last for at least 2 weeks and that interfere with a person's ability to work, to sleep, to study, or to just engage with other people. During COVID-19, what we are seeing is that major depression levels are going up for all individuals because this is a very difficult and upsetting time for many people. Another common mental disorder I want to talk about are called anxiety disorders. And these involve experiencing intense fear or worry that does not go away over time and interferes with a person's daily activities. Because so many of us are worried during COVID-19 of catching the illness or being out of work or just people around us, we are finding that anxiety disorders among Pacific Islanders are also going up. And the third important disorder to talk about for Pacific Islanders is what are referred to as alcohol use disorders or alcohol addiction. And this is a medical condition of drinking too much, too often, or too quickly. And this one is a big worry for clinicians such as myself during COVID-19 because we're finding many groups are stuck at home, they're feeling incredible stress or anxiety. So we're finding that alcohol use is going up, especially what we call problem alcohol use or alcohol addiction. In my own research with Pacific Islanders in LA County, California, Arkansas, what we're finding is that even outside of the time of COVID-19, there are extremely high rates of major depression, anxiety disorders, and alcohol use disorders. For instance, in a survey that me and the Office of Samoan Affairs and other community organizations across the country had conducted, Pacific Islander adults had 3 times greater rates of major depression than the national rate, had over 2 times greater rates of generalized anxiety disorder versus the national rate for anxiety disorders, and over 4 times the national rate of alcohol use disorder. And so this suggests that major depression, anxiety disorders, and alcohol use are extremely high during COVID-19, but also outside of COVID-19. When mental health issues are not addressed, they are not treated, One of the big concerns is that this tends to lead to other issues, such as issues with work, issues with social life and family life, and what we're finding most concerningly is issues with depression and suicidality. In research that we've done that looked at 25 years of national data, Pacific Islander high school students had over 2 times the rate of attempted suicide compared to white high school students. So we see a major disparity in mental health and substance use affecting Pacific Islanders throughout their lifespan.